Now, South Africa is likely to enter the fifth wave of COVID-19 infections in May or sooner. This is according to Health Minister Dr. Joe Phaahla. Phaahla briefed the media on Friday on government's efforts to fight COVID-19 as well as the national vaccine rollout program. Now, let's discuss this. We are now joined via Zoom by epidemiologist Dr. Joe Barnes. Dr. Barnes, thank you so much for your time this afternoon. Now, South Africa further eased COVID-19 restrictions, with some suggesting that the regulations just have been inconsistent at best. Just give us your thoughts and your thinking around what this means, possibly entering into a fifth wave, given that these restrictions have been eased in South Africa.
Good afternoon to you and afternoon to our viewers. I'm deeply concerned about the whole management aspects of the pandemic as we are facing it now. South Africa belongs to everybody who lives in it, and we owe safety and good management to all our people. And I'm concerned that the powers that be refuse to let go of the vehicle called the Disaster Management Act that allows them extraordinary powers, and you can almost say executive creep, expanding the executive powers beyond what the Disaster Management Act actually ever intended. And I'm speaking to you now not only as an epidemiologist, but as an active member of the Disaster Management Forum of my province. So I'm concerned that the regulations that they say will have to be put in place before they can let go of the Disaster Management Act as a vehicle for management came out. They produced it and asked for comments, but they are not logical. They're contradictory in many places, and some people even called them incoherent. It looks really as if it was cobbled together in great haste. We've been at now day 731 of the pandemic regulations. They have had ample time to realize, and many people told them, that the essence of the pandemic had changed. We are now looking to protect people from serious disease and from death, and not in any way being trying to prevent infection anymore. The whole nature of the pandemic had changed. We have vaccinations now that we didn't have in the beginning, and 70 to 80%, conservatively speaking, of our people either had some form of vaccination or some form of the disease by now. But all of these regulations are stuck in the past. And many of those stipulations are simply unable to be complied with. So I'm deeply concerned about the approach that the authorities have got to the pandemic by now.
Some people seem to think that, given the fact that, if indeed we do have this fifth wave, it will be less severe as other waves that we've seen in the past. In fact, even the fourth wave was to a large extent also not as detrimental as the other waves. So they seem to think that, given the lack of vaccination in terms of numbers, where we would have at least wanted South Africa to be, it's not really that much of a concern. What do you say about this, considering that we still have not met our targets as it relates to vaccinations, but also considering that with this fifth wave being less severity, there's also the prospect that a new variant could then come into the fray?
We have absolutely no assurance that the fifth wave coming relatively soon will necessarily be lighter. There are all sorts of developments on the virus front. We now have Delta Cron, which is a mutant between Delta and Omicron that's being watched at the moment. There is another version of Omicron, BA.2, that is even more infectious than the original BA.1, a variation of Omicron. So I'm not at all convinced that we can bank on the fact that the next one will be even more benign or lighter. What we desperately need to do, and the president said in his previous presentation to the address to the nation, is that we need to step up vaccination. But last week, I tried to get a booster shot, and I took the better part of a day in my environment to find a vaccination station that was open. They're all closed. So there seems to be many miles between saying and doing in this whole management process. I'm really concerned about the fact that vaccination numbers have been dropping off alarmingly, and that would be the new approach that we need, is to protect people by vaccination. And it seems to have cooled to such an extent that there's no interest in it, and it not only from the general public, because I met several people at many of these closed stations looking for a place for vaccination that they couldn't find.
This is concerning, considering that one of the statements that was, mentioned at cabinet level was that vaccinations remain our best defense against the virus. And if you look at, the Disaster Act that will, effectively not be effective come the 15th of April 2020, and what we are hearing is that this fifth wave is likely to happen around May, which is pretty much around our winter time. So it does then remain concerning that these numbers, these vaccination numbers, are very, very low. Where do you think the problem lies, Doctor? Because you have mentioned that you've also struggled, to find stations that are open for your booster shots. Do you think that the messaging was in fact the problem? I mean, now that we know a little bit more about COVID-19 than we did in 2020, surely there needs to be some form of targeted messaging so that those people, especially the group between the ages of 18 and 35, are targeted.
You are quite right. The messaging leaves a lot to be desired, but it started earlier than that. With these illogical regulations that you're not allowed to, you can only buy raw food, but you're not allowed to leave your home to look for firewood to cook it with. You cannot buy open-toed sandals, and you cannot buy short-sleeve T-shirts. These kinds of things already started driving in a wedge between a large proportion of our population and the people who make the rules. Now the same organization, the government, is asking people to get themselves vaccinated who sent in the police a year and a half earlier. It's hard. Trust is hard to build and quick to break down. And I'm afraid the lack of proper explanations, not just a poster that says get vaccinated in several different ways, but explaining and giving some background information and counteracting some of the anti-vax messaging that's flying around on social media. None of that has happened. And I bet you haven't seen any poster even or bit of information recently in the area where you move around. It just simply isn't there, except a few TV adverts and a few radio adverts, generally aimed at everybody. So there's no targeted information, and there's no information, just superficial statements. So I'm deeply concerned that this way we're not going to win the hearts of the people who are still hesitating about getting vaccinated.
Speaking about winning the hearts of those that do not want to get vaccinated, do you perhaps think that this mismessaging that is currently being presented, the reason that most people are simply now convinced that they shouldn't be vaccinating, because a lot of the times they've been saying that, with the Omicron variant, we have not seen people actually dying that have been vaccinated or not vaccinated. Those that don't have underlying issues are coming out of it and not necessarily being hospitalized. Do you think perhaps the messaging is somewhat supporting those views from people that have been saying there is no scientific proof that vaccinations actually work?
the messaging is not the reason, but it is playing into that scenario. Speaking as I have done to a number of people from the 18 to 35-year-old age group, talking to those who had themselves vaccinated, I asked and they said, well, somebody I trust convinced me. It could have been a grandmother, it could have been somebody at the soccer club, all sorts of various people, the young people, convinced them to go and get vaccinated. We need to reach those trusted people and say, can you please help us to talk to more young people in your environment and get them to get vaccinated? You are a trusted person, do that, but I haven't seen any messaging like that either. So yes, the reality shows them that in an intensive care unit of any large hospital, virtually nobody is lying there who's been vaccinated. They're almost all of them unvaccinated people. But somehow these hard facts does not impact on people's emotions. You've never been able to convince a skeptic by putting hard facts on the table, but emotions work. And that's where the trusted advisor comes in. So I feel that the messaging is not only far too broad and shallow, but it's not on point. We are not reaching out to those people who can really help.
Dr. Jo Barnes, thank you so much for your time this afternoon. Really do appreciate it. Dr. Barnes there reminding everybody to become the trusted advisor to encourage those to vaccinate as the country faces a looming